Welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about.
Hi, everyone. I'm Lori LeBay, your host of Alzheimer Speaks, and I'm thrilled you're joining us today. My mom lived with dementia for 30 years, so I definitely get it. And our goal here at Alzheimer Speaks Radio is to raise everyone's voice around the world. It's amazing what people are doing and all the services, products, and tools that are available, and we want to help you find them. Now, if you liked our opening music too, that's called Clarion Call by the Mark Arneson Band, and they would appreciate your support. Just feel free to go to any of your favorite music platforms and download that. It is summer, and the memory camp is back in Wisconsin at Moon Beach. It is going to be August 15th through the 18th, and you can call to register your loved one and your family to go at 715-479-8255. In addition, if you are kind of scheming some new ideas that will improve the world of dementia, check out Maud's Ventures. They are giving seed money, $50,000 to $100,000. Just go to maudsventures.org. They have 3 different challenges out there, and they would love to hear from you. And if you're looking for resources, please check out dementiamap.com. We have over 150 categories, a wonderful calendar of events. There's a glossary of terms, wonderful articles on our blog, and so much more. Go to dementiamap.com. It is free, and you are not going to be asked for any personal information. You don't need to set up an account, none of that. We've been listening to you, and we know that you're tired of getting spammed and hacked and manipulated by people who are grabbing your information. And if you have a service, product, tool, or information or support group that you would like listed on there, you can easily do that. We have a free profile as well as enhanced. Just go up to Join Dementia Map, or feel free to reach out to me for more information on that. And then if you're looking for a support group, I do facilitate 2. One is Arthur's Memory Cafe. We do that on the 2nd and the 4th Wednesday of each month from about 1 to 2:30 Central Time, though that is open to anyone around the world because we're doing that virtually now. Again, reach out to me. I'll get you information for the link on that. And then if you're in Minnesota in the Shoreview, North Oaks area, I've partnered with Brookdale North Oaks and the Shoreview Community Center, and I facilitate their Caregiver Connect program, which meets the last Wednesday of each month at 10 a.m. Central. And it also provides respite if you have a loved one who is, kind of early to moderate stages there. And again, you can reach out to me to register for that. We're going to hear from the Adaptive Equipment and Caregiving Corner. They're going to talk a little bit about the footbar walker. And then we're going to be right back with our guest who supports families with compassionate caring services.
I love the footbar walker, and let me tell you why. It is the option for my toolbox that I've been waiting for. Let's be honest, there are some clients who, despite our best rehab efforts, just aren't able to return to performing a sit-to-stand transfer on their own. Now I can offer my caregivers an easier, safer option that doesn't involve hoisting their loved one up from a sitting position. I don't recommend this walker for all of my clients, but I do recommend this walker for those caregivers looking for an easier, safer option with transfers. I would also encourage other therapists to add this walker to their toolbox. It's kind of like having my own mobile parallel bars for the client to pull up on. Whether it's a family caregiver at home helping a loved one with Parkinson's or dementia, CNAs in a long-term care facility assisting their patients, or therapists adapting to client and caregiver specific needs, we now have a very safe and effective option to offer in the footbar walker. Check this product out at thefootbarwalker.com. That's it for today from Adaptive Equipment and Caregiving Corner. Have a great day, and don't forget, if you can't do it, adapt it.
Well, I am thrilled to introduce you to Chris Zayid today. He has created Affinity Senior Care, and that was back in 2012. And his goal is to further serve members of that 55 and over community, which we know is an incredible need out there. Chris was able to craft a unique home health care plan tailored to whatever specific needs his clients had. And, that's a big difference, because a lot of times you have to kind of fit into little buckets out there when it comes to home health and home health care as a whole. So at Affinity Senior Care, they ensure that their employees are held to really high standards, which we all like to hear. So we know that they're trained well, and also that they love their work, ensuring that each patient is really treated with the utmost care and respect. And I know nowadays, Chris, that is an issue with staffing in terms of finding that quality staff out there. So thanks for being with us today. I'm excited to have you on the show.
Thank you. It's an honor to work with you and just kind of share my story. And I appreciate you, Lori, everything you've done over the years and serve the community, especially specifically the dementia community.
Well, thank you. Thank you. I think we're all, better together in this whole thing. Why don't we start out with, I always ask every guest of mine if they've been personally touched by a form of dementia within their own family or circle of friends.
Yes. My grandmother had Alzheimer's and dementia, and you didn't have to diagnose it. You kind of just knew, and sometimes when it gets down to activities of daily living and things that would have to do with, their daily dressing and memory and names, it slowly progresses to the point where, even if a doctor would tell you if they have memory loss, where you kind of knew that was not normal. It wasn't normal behavior to not remember your grandchildren or their names and everything. And so, but really, it goes back to 9 years old when I really started to see elderly diseases and conditions. And that was when I actually was going to work with my father at nursing homes and assisted living facilities. And so my dad was a podiatrist, and he would inspire me at a young age to go to work, and you go to work with him and see what he did. And so he was specifically in the healthcare field and didn't just take care of clients in his practice. And he went to their homes. So he went to their primary homes and also assisted livings and nursing homes and foster homes. And so I saw that at a young age, and a lot of the clients had dementia, Alzheimer's, Parkinson's, MS, cancer, you name it. If they're in assisted living, home wasn't a safe environment for them. So they had to live somewhere else to be able to have a professional care. So I saw that at a young age. And when you're young, you don't really process that. But just to answer your question, really, is that it started really when I was 9, when I was starting to really see this stuff and add it all up, and never thought when you're a kid that you would be doing this for the rest of your life, helping that population.
I think that's really interesting, though, because I think if I was told by an elder friend of mine, and she said, go back in your life in 5-year increments of who was the most important person or what was the most important thing that happened during those 5 years. And if you go back and you write it down, the dots really do connect. I mean, it's kind of profound to do that and go, oh, this is where this came from. This is where I got this. And so that's something you might want to try. It might, I just found it really enlightening and actually kind of fun to kind of think back on your life, because we kind of live and we just zoom by, but things I think do happen for a reason. Chris, we learned about your childhood and kind of stepping into that. And I think you got a whole different look going into people's homes too, versus just people coming into a clinic type setting. I think that's an eye opener in and of itself. What's your background to open up a business like this?
Yeah, I've had family members growing up who started their own business. And I've seen that all different avenues from, my grandfather seeing he came into America when he was 19 and then became an entrepreneur, opened up his own business, and all watching what he did to raise my father and his family. And same for my other grandfather, my other side, watching him, at a young age come to America and being an own business owner, surviving this, surviving to raise a family, and then cousins and aunts, seeing them start up their own businesses as well too. And, education was definitely instilled at a young age, watching our ancestors come and struggle and work and take care of their family, realizing that education is really important to be able to install in the next generation. And so I always kind of had it, I felt like, in my blood. I thought part of the business entrepreneurial mindset, I felt like started at a young age, and it was really because of my parents. My parents installed that in my head, and that how important it was to be independent, to take care of yourself, but it was not going to happen unless you do it yourself. Mm-hmm. So having a job every single summer was really important for my father as I was going to school, to give me a complete reminder of saying, listen, you're going to learn every single month, every single summer, you're going to have a job. But also at the same time, he said, you're going to want to go to school, especially working these jobs that, like, for example, not that I say anything's wrong with it, but waiting, busing, construction, working for a power washing company, the list goes on, working at a United Artists, theater, movie theater, and all these jobs. I would come back and I would just, obviously my dad would always respond back to me always, but this is why you go to school. This is, and school was great for me to be able to learn about life and people and how to overcome challenges, and learning those skills in school and communication as well, and building relationships. And so I pursued actually what I always knew what was important to me was the healthcare field. Mm-hmm. And so I went to Oakland University, and that's where I pursued my bachelor's degree, to go into actually the same field as my father, podiatry. Podiatry was something that I've seen at 9 years old. Saw my father, I love what he did. And so I pursued the healthcare field. And then I made the biggest switch, and the only career switch I ever made in my life, which is to go into home care. I switched at the end of my second year of medical school. It wasn't for me. It was really hard and difficult. My heart wasn't there. They always say if your passion isn't where you are, then, it's going to be difficult for me. And so that was the first thing I ever did. But the last time, I always tell myself, that was the last time I would ever do that, make a career switch and actually quit something that I wasn't passionate about. And I did. And so I stopped that and worked for my family's home health care company, not Affinity Senior Care. That was later on in life. Once I learned about home health care and I jumped in, I fell in love. I fell in love with it. It was almost like being in the business world at the same time, healthcare field at the same time, working with a team, everyone getting better together, from nurses and therapists going into the homes, working with the physicians, creating a care plan, making sure they have good outcomes. And so doing that on the field, working with my family, I learned about caregiving services, which was just a whole nother avenue. Clients, of our clients who had dementia, Alzheimer's, Parkinson's, MS. And I saw the struggles and the problems that they had. And I seen that a lot of our clients weren't 100% served by other companies that we were working with. So I took it upon myself to start Affinity Senior Care, which is our caregiving department, which was 10 years ago. Till this year was our 10th anniversary. And so that was, again, just one of those entrepreneurial things that in my mind is that I wanted to take our company to another level, be different than the community, but also offer a quality service.
Okay. Well, that's great background. There's a lot of confusion in the industry. There's, home care, there's home health care, and then there's private duty nurses. Can you explain those three sectors? Because a lot of our audience, it just makes their head bubble and they don't understand it.
Yes. So it's a common question most family members. Then the most common question that people ask is that home health care, the differentiator between in-home care, caregiver services, is when there's a doctor involved. A doctor does not have to be involved if you want caregiver services. Mm-hmm. You can also call it private duty or in-home care. That's the confusion. They both sound the same, but you don't need a doctor's script when you need caregiver services.
Mm-hmm.
But if you want home health care, the doctor does write a script, and that's when the nurses and the rehabilitation like PTs, OTs, speech therapists, and you also get a home health aide that's covered by insurance to help out with shower visits. And so that's covered by insurance, and the doctor is the quarterback on the case to make sure to see if you qualify for it. Now, you can be in different environments. You could be at home. Your doctor can write a script to a home care company. You could be at a hospital leaving, at a facility or assisted living, rehab facility leaving, or you could be living at an assisted living or a facility already currently, and you want the care to come to you. So that's usually still the doctor writes the script for that, and then home health care comes in, and that's covered by your insurance. Now, when it comes down to in-home care, the big differentiator is you don't need a doctor to be involved. Usually you have a home care come out and they do an assessment. Now, remember, this changes per state. Every state has different rules because there's licensure involved and there's regulations. In the state of Michigan, you don't have to require, to be licensed or have a nurse come out. You can have an owner like me or an office manager or CNA, whoever it is, still come out and do an assessment. So just a disclaimer that different states, there are different rules and regulations when it comes down to private duty. But across the board in the U.S., home health care is pretty much the same. You have to be licensed in the state of Michigan. So that's one differentiator, is that most home health cares are licensed, and they're have to be accredited by Medicare. Medicare has to accredit them, and also the state has to make sure they audit their charts and making sure that they're doing everything right and they're charting right and the outcomes and the goals and the billing is correct as well too. Versus caregiving services, it's a little different where they are managed by hourly care. So you can create a schedule, and if you can manage your budget, and you pay out of pocket. And if you want to customize your care for 4 hours a day, 6 hours a day, 12 hours a day, or around the clock care, you can customize that depending on your budget. Now, when it comes down to insurances, the differentiator with home health care versus caregiving offers long-term care insurance. Medicaid can help cover. There are VA benefits as well too. And then workman's comp and disability, sometimes you could kick in sometimes as well too, to be able to help with care as well. And then last but not least is auto. So if you're involved in an auto accident, that always helps out with all type of care involved in auto. It can actually cover both home care services.
Okay, so I want to just make sure that I have this clear in my head. So with home health care, that's when the doctor does it. It's covered by insurance, and they are licensed, and they get audited by Medicare. Is that correct?
Correct.
Okay. And then home health and private duty is out of pocket or cash, unless you have a long-term insurance policy or are a vet, or maybe been in a car accident or had an issue with workers' comp. They will cover that as well. Or did I get that mixed up?
Nope, that's right. Yeah, you could be injured and working, and you might need care at home, and that's when a home care company comes in.
I didn't know if any of those, like the long-term insurance and the VA, if that overlapped with home health care as well.
Long-term care insurance policies, depending on what your policy is, all of them are different. So they do some spill out in all categories. It could be home health care, caregiving, and also care and assisted living. And so they typically give like a allotted amount of reimbursement per day. So if you're staying at a facility per day, they'll say, we'll give you X amount. If you are needing caregiving services, they'll say, we'll give you X amount for a whole day.
Gotcha. And it is complicated. Like you said, every state is a little bit different. They use different terms sometimes that twist things. And like you said, those policies are different. So for Affinity Senior Care, you fall under the home health that doesn't need a doctor, correct?
Yep. Affinity Senior Care is our non-medical home care services, caregiver services, and our home health care company's Affinity Home Care Agency. This is our other entity, our other department that we have.
Okay. So you've got two. So how would you say that your home care services are different from the average bear out there? When a family is out there going, well, they all say home home care, they must all be
Yeah.
the same. But I know you're
You-
not.
well, the services are the same. I really hope that everyone, when they go in the industry, the purpose and the mission is the same. I hope everyone that really is in this industry is really doing it for that. But really what separates us is I'm sitting here in my office, and on the other department, my dad's in the other office. Like, we're here. We're involved, and it's a family. So it's a family oriented type of feeling. We're not going to make it's not a corporate type of, hey, we're going to call the office and press 1, press 2, press 3. If you want to talk and get things accomplished and done regarding it has to do with care, then we're going to take action on that. And that's what separates us, is that we're always available, and we have enough team members here that we really are here to be able to make sure that the number one thing is if they need care, we get the right care professional that's there. And that is what separates us, is that we're always concentrating on that they're getting, the right person that's meeting the expectations of what the family are asking us to do.
Okay, wonderful. That is helpful. Can you give examples of what that looks like? What are some of the services? I know there's a variety of things that your company can help with, and a lot of families might not know what does that really mean.
Yes, so we call it activities of daily living, the type of care that we provide, and that's what that means is you and I are so fortunate. We close our eyes and we think about how we can wake up every day and make a decision and a choice to take care of ourselves and be independent. Now, take away little things like that, like brushing your teeth, combing your hair, taking a shower, getting dressed, preparing a meal, taking your meds, and jumping in the car and going and doing what you want. Now, if you take away one of those, or 1, 2, or 3, or 4 of those away, caregiving services help you with that process to make sure that you're doing it safe, and also too is you keeping your dignity during that whole process. Now, what really limits a lot of our clients is, especially nutrition, medications, and mobility that really can limit you from a lot, because if you're not taking your meds, that means that they're going to have you're going to have a reaction from that, not taking your medications. Mobility, if you have a fall, and especially if someone's not there, that can cause you a brain injury, go to the hospital, and that could be severe. And then nutrition as well too. Not eating all day is not good as well too. Not eating the right foods or anything like that's not healthy, and that's not a good quality of life. And so that's what caregiving services is all about. It's called the daily care that all of us that we can do is slowly do. It doesn't matter what disease or what process you have. It's just one of these conditions of activities of daily living that is limiting. And the caregiving is supposed to make sure that we can slowly and compassionately and patiently go through that whole process of what they can do. Some can do it better than others, and it's okay. And some are there's going to be a good and bad days about accomplishing those tasks.
Okay. So a couple other things, I think those are all straightforward. Like with transportation, it might not be that you get in the car and drive because family doesn't feel safe with them, but you're going to drive and get them where they need to go. Would that be a correct statement?
Different laws in different states, and they have with different laws with the auto. And so it depends. Other companies should have a non-auto insurance policy, which means that if a caregiver is going to jump in the car and take your mom and dad, you have to make sure that covers the caregiver if they get into an accident, and the client as well too. This is a big thing. So when there's transportation involved, you have to have the right coverage for your family, and also that the caregiver, if she's working for a professional company, that they cover that type of scenario. But yes, that can happen with most companies, but some don't do transportation services at all. And they can have the caregiver sit in the back seat, the family members drive, and then when they need help with getting in and out of the car or going into the doctor appointment, then they can also do that too. I've also seen where caregivers will travel behind and drive their own car, and then the client is okay to drive, is everything,
Mm-hmm.
but they just want someone there because they feel maybe possibly they're getting an eye surgery and they're going to be dizzy right after.
Mm-hmm.
Actually, that's not a good example because they shouldn't be driving in that scenario. but for they would the husband is okay. The wife is having a procedure. He's driving, but he's not strong enough to get her in and out of the car. So the caregiver could travel behind them and go with them to the appointment as well too. So there's different scenarios, but yes, always ask the company that you're working for is that they have the right coverage to make sure that could happen, so that we could protect yourself in case something, if there was an accident.
Okay. How about like socialization and entertainment? Like I had a friend whose mom was living in an assisted living, and she just loved, she lived out east. She loved going to the plays and stuff, but she couldn't do that on her own. And so, they had hired somebody to go with her, and so she could still have that piece of her life because family wasn't close by. Is that something that somebody could hire you to do? And again, you'd have to figure out the logistics of getting to and fro of that.
Yeah, the first thing I think about when I hear that is, going out and doing social events and going to church and all that. The first thing I always install, especially in our team, is presentation. They're going to go out to the community, and this caregiver has to look really good and present, because they're going to be almost a representation of their family. They don't know that she's a caregiver sometimes.
Yep.
They don't know if it's a friend or a neighbor or whatsoever. So presentation is super important that when they're going to go out and being social, and that is essential. If they want to go to a play, man, like in our office, we get really excited that our client's going to go and do what they want, because that's what home care is about, is that they shouldn't limit their life. So going and doing what they want, if the client is expressing themselves to do that. And so, that's really the joy of a caregiver when they get done with that event. I've done it so many times where I would go to an event, and at the end of the day, I'm just thinking like, I'm so happy I had that experience with them, and that they were able to leave their house for, and do that. Some of our clients, they're at home all day, and sometimes their family members live out of state, and they don't do much, and it causes depression. So anything that has to do with any social events that is like one of the pillar, an excitement part of a caregiver. It should be, if you're a caregiver, it should be one of your excited purposes of why you're doing what you're doing.
Well, and I've heard stories of people going to weddings and things like that, where maybe a person can't last the whole time, and this way family member doesn't have to leave early to accommodate that. So, I mean, there's a lot of pluses for everybody involved in that. How about if somebody still wants to travel, but they need more assistance? Is that something like going on a vacation for a week? Maybe they want to go on a cruise, or is that something your company can handle, or are they better off, going to find an actual travel companion?
It's all contractual, and agreement and transparency is important.
Okay.
Honesty is going to be important. So if they have a caregiver that they can trust, that will go, and we lay out all the expenses and all the stipulations regarding this trip, so that way everything's clear. Then I think that's great. I don't see why not. But I've also had partners where clients would go to Florida, and then they would transfer to their Florida home, and then the Florida company would take over. And then when they come back to Michigan, then we would just resume the Michigan care as well too. So it's all situational, but it really comes down to having somebody in your family that you could trust.
Okay.
So if you really develop a relationship with the caregiver, and they're going to go on a trip with you, I think that's a really good thing, that you have somebody there that your family enjoys to be around. They trust them. Your parents like them to be around, and that's great. Now, crossing over to state, there's different regulations when it has to do with if you're a home care company and that you're hiring an agency and what could happen, right? So you have to look into the stipulation of what state they're going in, and then if that liability will cover that caregiver in that state as well too. So that's something you talk to your insurance agent about, and always just make sure that you ask them that question. You know what I mean? Is if they go, is it just the same thing as them being in another state?
Okay. What about if they, because sometimes people don't have family, but they might want someone to go with them to a medical appointment, just to be eyes and ears, taking notes and helping them get orchestrated. Is that something that your company, feels confident that they can handle?
Yes. Yeah. Especially dementia, especially it's important to take notes and find out exactly what the doctor is. Usually the type of scenario is, one, the family's with us,
Mm-hmm.
and there's, and our client and the caregiver there,
Mm-hmm.
okay, assisting with any type of standby hands-on assist and taking any notes and any type of personal care during that period of time if they do need assistance, and going toileting during that visit that they're at. Or the family's not involved, and we're reporting and making sure we take really good notes and updating the care plan, and then bringing them safe into 2 different environments, in the doctor's office and then back home.
Okay.
And so, yes, to answer your question, that's what we can do. There are also too a lot of resources that are out there too. There's doctors that come to the home now. Mm-hmm. There's lots of resources that actually come to the home and can do home visits, and there's virtual visits too. There's a lot of information a doctor can get from a caregiver, answering some questions that the doctor needs to know when a client has dementia, and you can have a 3-way call with another family member. But I'm a fan. I'm a more kind of an old school traditional guy. I like in person when it comes down to care. I like to see and talk to the doctor and touch and then let them touch and feel what's going on, if there's any type of test that they have to do or anything. But it's all situational.
Okay. And then like chores around the house, from changing the linens to cutting the grass to getting the mail, those can all be part of the contract as well, making meals and...
Yeah, the light housekeeping. Yeah, yes, it's the meal preparation is like the, one of the perks. I say it's a perk of having a caregiver, right? It's you want to provide this because you would want this for yourself. I always say, if your home was not clean and not tidied up and smelling and all this good, and things were not done, who else is going to do it?
Yeah.
And so that's what our duty is that if we see something that's not being done in the home that we would do for our own self, which is the light housekeeping and the meal preparation, then that's our duty as a caregiving company to serve and make sure that, what we see is done and what we would do for our own self is performed.
Yeah, because all those things are, safety issues too, in terms of quality of life and things. Well, last thing I'm going to ask is, because some people might think, well, I just need help paying bills, but I know that can get into a whole nother realm, and there are money managers out there themselves, that are licensed and bonded. Is that something you ever get involved in, or is that one of those things just I'd rather refer that out?
Yeah, so different diseases where I'm losing my eyesight, I can't manage and do my bills. I'm having dementia and memory loss, and I can't remember to pay my bills on time, and I'm starting to. So what do you do? So we try to stay away from the financials and have another family member involved, and that's when we get power of attorneys that are who are going to be involved with the financials. So that way we can, luckily now everything's electronic, and mail can be redirected somewhere else. So we try to redirect it to a person that's going to be responsible of that piece of their life, but doesn't always happen. Convincing mom and dad to take away their things that they know what they want to do can be a very difficult task too. So the caregivers, we really, to answer your question, we don't really like to be involved with any type of money management or anything, or, that has to do with that, just for the protection of our clients and the information that's coming in that's very confidential as well. And so we try to involve as many family members or anybody close as much as possible than the caregiver. And it's not saying that we don't trust the caregiver, but that information should be managed by somebody they have known before they met us to develop a relationship as a caregiving company.
Yeah, it's a whole nother level of training in terms of keeping certain documents and things private and so forth. What type of feedback do you get from your clients and also their families?
Thankfulness, gratefulness, relief. Yeah. Yeah, those are the top, relief of their life and burnout and need time for themselves. And that's what another word comes in my mind is gaining time and quality time instead of doing the actual care time, and that could really put stress onto the relationship of you and your mom and your dad, and filtering and delegating that out. So, but and frustration too. I could say frustration. A lot of families can be frustrated, and in the environment of COVID right now, and the workforce that is out there too as well. We can't set that aside as well to discuss that. People now can be frustrated with, if caregivers are in the stigma of the whole industry in general, if they're late, they're not showing up, they're not performing their skills the right way. And that could be frustrating too, as well. Family members are trying to make sure they get quality care. And also too and they rely on a third party to come into their parents' home and care for their parents, but don't do a good job, and they are paying for a service. So that can be frustrating too as well.
Yep. Yeah. And I can see where the whole thankful and just lifting that burden, it allows them to get back to their relationship instead of more things to do, on their list, and really enjoying their loved one. Is there anything, Chris, that we haven't covered? I think we've done a nice job in terms of explaining the differences between, home care, home health care, private duty, the types of services, and even just distinguishing that, hey, everything's not the same, state to state, company to company, and you need to ask your questions and really dig deep. And I think anytime you are hiring a company, you need to listen to your gut and don't be shy about asking those questions. I would imagine you expect questions from your clients.
Yeah, we try to give all of our answers to you. I'm sorry, my cough, but go on our Facebook page, go on our podcast, go on our website and listen to our stuff. Watch what we're presenting, join our newsletter. All of our answers are given to you. We have an Affinity Dementia support group on Facebook. We give as much information as possible to answer your questions and give you support, because there's not the only answer is when it's either you caring for your parents and learning. We learn, right? Learning is forever, everlasting. We learn how to approach depending on our parents' behaviors, or we hire a company that has invested their time and energy to be able to help with managing those tasks and the behaviors and the care that you need. When it comes down to making sure that you feel comfortable with that care professional in your parents' home that that will keep them safe and provide compassionate care, and also too is be dependable and reliable as well. So never give up. That's all I could ever give it family members advice. It's just never give up on your parents, especially when they have a disease that is uncontrollable. It's not their fault, and patience is so important. And don't be fearful of asking for help for home care companies or asking for help with your church and your neighbors and your friends and your family. There's a lot of good people out there that can help with this process.
Now, one question I just thought of as you were talking was, I know some people say, well, we want the same person to come all the time. Is that realistic in today's day and age of staffing? Or it probably depends on, how many hours and, all of those types of things too, and how consistent they are with what they want from you.
Great question. Dependability and reliability, right? Oof. And it's gotten worse over COVID, I'll tell you that, where people you can count on that are humans taking care of humans. You would never think that someone would not show up caring for an Alzheimer's and dementia person, right? But then take a human aspect of that. They have kids too. caregivers, and they have car problems, and they have health issues, and they have personal issues, and A, B, C, and D that causes them not to show up or can't go to work. So that causes the dependability issue in the industry when caregivers are going through that all the time. So yes, it's there, and it's something that you have to prepare family members that it could happen to them, or it might just not happen at all. They might have a slam dunk and just have somebody that is accountable for their career that they're in, and some take it more serious than others. And that's what our job is to find out right away if that is occurring, so that way we can get somebody that really is dedicated to the family. I talk to my manager about it every single day, and because of the amount of clients that we have are a lot. So but I've always remind them that if you work with a company that that they're doing everything they can, if they're doing everything they can, that they're trying their best for you, you're in a good scenario that they're because that company most likely is having resources, they're paying their employees well, they're paying they're doing things to make sure that they can cover when those that someone's not dependable, not able to show up, or no call, no show, or if they didn't show up on that shift, or they're showing up late, they're always developing resources and ways to be able to help you and with getting the right care professional. And so if you don't feel that they're working their butt off for you, then I don't blame you. Go to a different person. But that's why I always talk to my manager. As long as our families know that we're working our butt off for them, we're not sitting in our chairs right now and twiddling our fingers and thinking that it's okay to leave our seniors at home alone. Then we may want to think about switching your home care company.
Yeah, it's hard. And I think the other thing that people have to remember is that none of us have perfect days. And so we can't exactly expect a company to have a perfect day every single time or perfect service. I mean, it's the ideal, but realistically, we screw up too. And we hope that people are compassionate in terms of understanding that. Now, if it's a pattern, that's a whole nother thing. Or, and depending on the seriousness of it, all has to come into play. But one of the things that I found with families in dementia is they're demanding perfection when perfection wasn't in the life before it started. and so that makes it a little tough,
Yeah, I agree with you. You said something was empathetic. I think that's really good for family members to hear this, is that yes, there's no perfect company. There isn't. And it's not fair for a company to shake your hand and say, like, I'm gonna promise you that a diamond, because that's very rare to find even a diamond in general. It's it's hidden, and it's hard to find, and it's almost impossible to find. But when you find it, it's actually a beautiful thing, right? So sometimes you find that right caregiver, and she's a good fit for a year or 2 or 3, she stays with you. But to really find a perfect company is very difficult, because there's things do happen. So it's good to be patient with the home care company and understanding. And we let you know that these things do happen. And, most companies really are heartbroken as much as they are if something doesn't go right, and they really try to fix it. But sometimes there is this percentage of in this industry that they might have to call you and say, I'm sorry, we're capped out on all our resources.
Yeah.
And that's when other family members say, hey, listen, we got it today.
Yep.
Tomorrow's a new day. Tomorrow's a new day.
Well, and I think go ahead, Chris. I'm sorry.
We as a company, we appreciate, working with family members that understand us too.
Yeah. Well, and I think families also need to, not, because I fell into this with my own family, and I think a lot of families do, is that when you turn over care, you're trying to protect your person. So you're looking for what's wrong. And when you're looking for what's wrong, you're going to find things that are wrong. but don't forget to look for things that are going well, because that is huge. And sometimes I've seen families, cancel a home care or home health care, and the patient themselves is devastated because they actually had a really good relationship with that person. And you just said, hey, they didn't show up. And they're like, but they've shown up for, every other thing. They go over and above, but that's not heard or listened to. And I think it's really important to know how is the person you're serving feeling about this too, because a lot of times families not around to see those relationships and how things are being done, between your staff and the person being served. And that needs, I think that's a really important factor to be taken into consideration.
Yeah, it is. To serve, and on both ends, is both have to understand and put each other in each other's shoes. The family members who have developed this relationship with each other, and the caregiver and company that is serving you, is that you said it in the beginning, is that to me is that we all get better together, right?
Yep.
And if you can, everybody and works together on top of what the home care company really are, giving them the best care possible. And it is the best care. If you decide on your to keep your parents, whether you move them back into your home or they're staying in their home for the rest of their life, this is the best care possible you can give them. And it's and so. And then sometimes home isn't also the right place as well, too. I have to say that, sometimes homes aren't the right place, and that's also okay, too.
And if somebody moves into a community setting, you can still serve them there, correct?
Absolutely. Yep. It's good to have a good relationship with assisted livings and independent living. There's two different scenarios. Independent living is you and I living in an apartment, and we're fine. But if we decline, then we need help. That's when a home care company comes in. But assisted livings typically they have split up into a memory care unit where it's kind of more care. It's monitored much more strictly. Usually the rooms are locked and the doors are locked. And so an assisted living has the care there, and it's expected when they do move in there that they need a little assistance versus them just getting in their car and being independent. Yes, and so usually family members hire a home care company one-on-one. So it's in their room for that person. Care plan is designated exactly what the family member's expectations are. And so that happens a lot. It's not uncommon with COVID. Staffing a huge facility that's 50 to 100 beds is very difficult in general in itself of a business model. If someone doesn't show up to work, you have to be in tune with your parents if they're getting the right care. And sometimes it comes down to a point where you just want someone there at all times to measure and scale their needs.
Yeah. And that brings up another question. Because there are some families that just want to hire a live-in staff. Is that where a private duty nurse would come in? And are they necessarily a nurse to be a private duty nurse underneath that title?
I mean, the different states are different and the family's needs are different. So sometimes it could be an LPN, it could be an RN. They're pretty pricey when it gets to LPN and RN, and especially what they could possibly make in their own careers and out there. But CNAs, home health aide, and direct care workers, there's a lot of family members go to church and they find somebody, for example, say if someone speaks Spanish, and their parents only speak Spanish, that's a communication barrier. And some family members get somebody in the church that who is okay to live in their home, cook their own food, speak their own language, and so that happens all across the world. And live-in is a great service too. It's just a different type of rate that you'll pay, and family members usually sometimes just manage it on their own, and they can do that. But you are the scheduler, you are the biller, you are the trainer and the educator when you do that on your own. But yeah, live-in is also a beautiful type of care.
Okay.
You can have.
Well, sounds good. Well, people can get a hold of you by going to affinityseniorcare.com, or you can always call them at 248-363-8430, and that's 24/7. There'll be someone to answer. Is that correct?
That's correct.
Okay. Well, thank you, Chris. It's always a pleasure to talk to you. And I know this will be great information for our audience to have. So for those of you listening, please like, click, and share. Don't keep things a secret. Other people need to know this information too. So pass it along and just make the world a little easier place to be able to find product, service, and tools that people need. Thanks, everybody. Till next time.
Thank you, Lori.
Thank you. Well, hi, I'm Lori LeBay, and I wanted to tell you about Alzheimer Speaks, which is another great podcast. You see, my own mother lived with dementia for 30 years, and I felt lost. Did you know every 3 seconds someone in the world is being diagnosed with dementia? Odds are it's going to hit your families too. We want to help you connect to services, products, tools, research, and stories so you can be prepared. Please subscribe to Alzheimer Speaks on your favorite podcast platform.